Almost 400,000 people in the UK alone and tens of millions around the world are living with aphasia, a language impairment caused by a stroke. Many get insufficient treatment because of physical disabilities that prevent them from getting to appointments. Well, Dr. Celia Woolf from City University joins us now to talk about a new type of therapy that will make treatment far more widely available. It's been funded by the Tavistock Trust for Aphasia and the Bupa Foundation. Thanks a lot for coming in. Just tell us a little bit about this and what it does.
Yes, so what we've been exploring is different ways of delivering therapy, because as you said, there are a lot of people who have aphasia, which affects their language and their communication and often makes it difficult for people to go back to work and affects their relationships, and often people become quite socially isolated. So there's a big need for therapy. But the resources don't really allow people to get as much therapy as they might need. And as you said, that often people have physical disabilities, or they might live in a rural area, so it's quite hard for them to access therapy. So what we're doing is we're carrying out some research to look at other ways to deliver therapy. So using very widely available technology, so things like FaceTime or Skype, which is free on most computers and many people have access to it, as a way that people can access therapy without having to go to appointments. So a therapist could be in the clinic or the hospital, and the patient could be at home and carry out the therapy without either of them needing to travel. So we've been doing some research looking at how effective it is to carry out therapy using FaceTime or Skype, and also how people who've had a stroke respond to that, whether they're comfortable to use the technology, whether they're happy receiving the therapy, and whether the therapy works.
So what have basically been the findings, and are people happy to have this kind of therapy online, and does it work as well? Yeah,
we've been really encouraged by what we've found out. So far we've done a relatively small trial, and we're hoping to do some further research later, but from what we've found out so far is that people, even if they've never used a computer before, were very able to learn to use this technology. So we were particularly using iPads, which were fairly easy for people. So people got the hang of it really well, they liked it, and people were equally happy whether they had the therapy over the internet or whether they had the therapy face-to-face coming to the university.
Doing this kind of thing remotely is obviously logistically very useful, and in terms of travelling long distances, etc.
Yes.
Does it really give the same level of therapy that face-to-face human interaction would?
Yeah, well, that's one of the things that we're trying to find out through our research. So what we've done so far is we've carried out a very tried and tested kind of therapy, which is to help people who have problems with finding the words to express what they want to. And it's a therapy we know works really well face-to-face, so where a therapist would assist somebody to say the words and give them cues to practice and help them to say the words. So we already know this works face-to-face, and what we wanted to find out is whether it works as well when it's delivered remotely. And what we found is that yes, it does.
Yeah.
We're finding very similar results, and we've also found that the therapists were able to carry out the therapy in pretty much the same way as if they were face-to-face.
Okay, well, it's very good news for the 400,000 or so people in the UK suffering from this. Wish you the best of luck for it. Dr. Celia Woolf, thanks very much indeed.
Thank you.